So if you're a triathlete, odds are at some point you've probably dealt with Achilles pain or calf discomfort, maybe even pain in the bottom of the foot. It's kind of all lumped together in these lower leg injuries. Today we're going to talk primarily about the Achilles. The Achilles tendon is the lower part of the calf that attaches to the heel here, this big cord-like tendon. And it's an extension of the both the calf musculature, the gastrocnemius, and the muscle underneath the gastroc that's called the soleus. That's really the driver of the foot. So repetitive running, especially running, even cycling to some extent, can really put a lot of strain on those that calf musculature. Today we're going to showcase primarily an active release technique treatment for the Achilles tendon, the gastrocnemius, and the soleus. Okay, so the first thing we're going to do is some active release on the Achilles tendon itself. Okay, so this is a very thin structure, and when it's inflamed, it's very tender. So it can be a very intense. I don't want to use the word uncomfortable because we don't want to put a negative connotation on it, but it could be quite intense stretch. So with ART, what we're always going to do is we're going to shorten the tissue first that we're working. So the job of the Achilles tendon is to plantar flex the foot. So if you're in toe off, if you're driving through the toes, the Achilles tendon, the calf, the gastroc, is all going to be contracted. So we're going to start with the foot pulled up here. I'm going to contact around the Achilles tendon here, okay? Get my tension. And then what I'll do is actually with my knee here is I will drive that foot into dorsiflexion here, getting a nice stretch through that Achilles tendon. And anything with an ART, a simple ART move like so, this is a level 1 move. We're going to do about 7 to 8 passes on the structure. We're going to make sure we hit the whole structure here. Again, we're showcasing primarily ART. This is a tissue. We often use other modes of soft tissue treatment like Graston or muscle scraping, also known as, to treat this too. So we'll just focus on ART today. The next thing we'll hit is a muscle called soleus. This is a very important muscle. This muscle lives directly underneath the calf, so just deep to the calf. And its main job, it's kind of the main driver in foot plantar flexion, pushing the toes, again, off the ground, okay? So it's the driver of that, whereas the gastrocnemius, the actual calf muscle, is more the power muscle behind that motion, okay? So oftentimes this is a very inflamed muscle on a lot of runners, a lot of people who spend a lot of the time their day walking or even standing, nurses, things like that. So you can see as I push down on this muscle how the foot wants to come up into that plantar flex position. So I'm going to be pushing down on this here, right? Getting my tension, same thing, shortening the muscle. And I just need to make sure I get nice and deep past the calf so that right onto that soleus, get my tension, and same thing, we're just going to stretch that. I know this probably isn't the best angle with my hand in the way, so I'm going to switch hands just for the sake of this demonstration. So good. And a good stretch here. And we can work this muscle all the way up to pretty much 2/3, 3/4 of the way up the calf and almost to the level of the knee, okay? So this is a very good muscle to work here. It's tough to sometimes get past the gastroc, the calf muscle itself. And last muscle, of course, is the calf. So the calf is, again, the powerhouse. So if you're just walking, you're using primarily soleus. If you're sprinting, you're going to be using a lot of gastroc. So we want to make sure that we're alleviating those symptoms as well. Those two muscles, the gastroc lies on top of soleus, and they come down together to formulate the Achilles tendon. Okay, so they're both extremely important to work here. So with the gastroc, a little different. So again, plantar flexion. This muscle actually crosses the knee too, so we're going to bring it into knee flexion. We're going to get a nice, good grip on that calf. Bring it down and extend. Great, just like that. Feels great. Alyssa will tell you so, right, Alyssa?
Yeah.
See, told you. So mostly ART treatment for the calf. We're focusing on triathletes, of course, which we see a ton of them. Doesn't mean that we can't do the same move on somebody who's not a triathlete with Achilles pain, right? So Make sure you follow along. Next week's video, we're going to go over a few simple at-work exercises you can do to help treat any sort of Achilles pain or Achilles tendonitis that'll kind of keep you active during that 9 to 5 job.